Thank you. Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair in the Department of Epidemiology at Rollins School of Public Health here at Emory University. Since March, I've been leading Emory's COVID-19 outbreak response team working in hard-hit communities in Georgia. It's been my pleasure to host Emory's COVID-19 Facebook Live events, and we're coming to you today with a special one where we're going to be speaking with Dr. Carlos del Rio about the CDC. Dr. Del Rio is a distinguished professor of medicine, epidemiology, and global health here at Emory, and is the executive associate dean of Emory University School of Medicine at Grady Health System. Dr. Del Rio is also the co-director of Emory Center for AIDS Research and the foreign secretary of the National Academy of Medicine. As an infectious disease physician, he's an expert on COVID-19 and is one of our investigators for Moderna's clinical trial for the COVID-19 vaccine. Just this week, Dr. Del Rio was awarded the Distinguished PR Award from the Public Relations Society of America's Georgia's chapter for his incredible and consistent work to get correct information about COVID-19 out to the public. Thank you so much for joining me today, Dr. Del Rio.
Delighted to be with you. How are you?
I'm great, thank you. Today we're going to be talking about the CDC. So that to make sure everyone watching understands, the Center for Disease Control and Prevention is where we most expect to turn to for our public health information, both in the United States and across the world. It has a main goal of protecting public health and safety through the control and prevention of disease, injury, and disability in the US and internationally. The CDC has been focusing national attention on developing and applying disease control and prevention, and has been doing this since 1946. So you would think with COVID-19 and a pandemic occurring, this would be exactly who we're hearing from on a daily basis in the United States and across the world. So Dr. Del Rio, can you share with us your thoughts about what's been going on with the CDC and why they've been missing from our pandemic plan?
Well, yes, Jodie, let me just start by saying and emphasizing what you mentioned. CDC is a national and an international treasure, and we are extremely lucky to have CDC here in Atlanta. In fact, it is one of those amazing things that happened because of the visionary Mr. Woodruff. It was Mr. Woodruff that, talking to President Roosevelt, said, you know, CDC back then was eradicating malaria in the U.S. And said, you know, why don't you put CDC here in Atlanta where we still have malaria, and I'll give you some space near this place, this big piece of land I have where now it's Emory University, and you can put CDC there. So CDC became neighbors to us at Emory because of the visionary way in which Mr. Woodruff thought. And for us at Rollins, CDC there's no other place around the world, no other school of public health in the world that has a CDC right next to it. So we are exceedingly lucky, and therefore, not only do we read about CDC, we interact with them all the time. They are our colleagues, they are our friends, they are our neighbors. In my street, several CDC people live. And because of that, we know of their expertise, and we read their articles, and we know that when you're talking about who is the person that knew the most about Ebola and viral hemorrhagic fevers, it was a man named Pierre Roland, who's now retired from CDC. And when you said, who is the person that knows most about, influenza, and everybody says, well, there's Tim Uyeki and there's Nancy Mesomir. So the names that around the world are said as the leaders are people that work at CDC. And I would say for those of us that work at Emory, it's a little bit frustrating, right? Because you travel internationally and you say you're from Atlanta and everybody says, oh, you work at CDC.
That's exactly right.
Because that's how they know Atlanta, right? Now more people are knowing Emory, but for many years we were known because we were right next to CDC when we travel internationally. And not uncommonly, we would get introduced like Dr. Del Rio, who works at CDC, and I have to say, well, I never worked at CDC, but I worked a lot with CDC. So there are colleagues, there are friends, and we know how much they know, and we know their expertise, and we know how much they had been working to get ready for something like this. They had been doing tabletops. In fact, just last year at Rollins, we had, if you remember, we organized a one-day symposium remembering the sort of looking back at the 100 years of the influenza pandemic of 1918 and looking forward, right, what to expect. And if you look at the list of speakers, a lot of CDC people there, including we convene a panel of former CDC directors, and Dr. Besser, Dr. Gerberding, Dr. Frieden, many came to that panel because Dr. Faggy, because they all wanted to be part of this. So CDC, I would imagine, was like the elite squadron to fight something like this. This is the people you want in the front line. And in fact, they were involved from the beginning. You know, CDC very early on got notified by CDC China that something was going on, and they started working with this, and they sequenced the virus. And CDC scientists initially started working on developing tests. And yes, there were some issues. They clearly had some problems developing the tests, and there were some issues that delayed us in the response. There's no doubt. I think everybody, when you look back, says, well, they could have done it differently, but it was what it was. But in the meantime, they were doing many other things. But I think there were two events that I think were very critical. Number one is, you know, Nancy Messemer had a really clear communication one time in which she said, when she realized where we were going, she said, you know, we need to be prepared for major disruptions to our lives. And she was absolutely right. She was absolutely true. She was speaking the truth. She was saying what public health needs to do. But that created enormous concern and outrage in the administration, and directly with the president, who clearly was saying at that point in time, if you remember, he was saying, we have 12 cases, but it's going to disappear. It's going to go away. We got this. And he didn't want to hear about major disruptions right as we were going into an election year. And therefore, CDC got rapidly pushed aside in silence. And CDC essentially has been not in the front lines. They've been working. They've been doing things, but they've been working under very, very difficult circumstances in which many times their premier publication, the MMWR, their premier recommendations, their guidelines are doctored, are modified, are suited to what the administration wants the message to be. And the meddling of politics into public health has been enormously damaging to the life of Americans.
So in your opinion, they were silent specifically because what they were saying and predicting was contrary to what the administration was telling the general population of the United States?
Well, and what the administration wanted to hear, right? I mean, I think when we read Bob Woodward's book, the president understood. The president clearly knew what was going on, but it was trying to convey this message of everything is fine that I think clashed with the reality. And you know, you can't hide the reality. The reality is there. There's, you know, over 10 million Americans infected. There's over 250,000 Americans who have died. Today alone, we're going to reach 200,000 infections, if not today, in the next several days. We have a national emergency.
And to be clear, that's number of infections a day.
Oh yes, per day. 200,000 newly diagnosed individuals per day. I don't think in my wildest dreams I would have ever think we were going to get there.
Right. We were trying so hard to make sure we did not.
I mean, at some point in time I remember during March, April, hearing, well, you know, we can bring this down and keep it around 20,000 new infections per day and keep it there until we get a vaccine. We're going to be okay. Well, we're 10 times there.
Right. We are indeed. So to quote another CDC colleague of both yours and mine, who's now with us at Rollins School of Public Health, our dean, he commonly says, public health is political. There's no way around it. But I think what we've seen here is it's not just been political, it's been bipartisan politics. And that is really what's gotten in the way with CDC. So what are some of your thoughts about how they're sidelining in this pandemic, what it has done to the way we have functioned with this outbreak in the United States?
Well, I personally feel like we have, we are an orchestra without a conductor, right? We don't have somebody who's then taking the information and translating them. I mean, when I think about an A response to a pandemic, I think about 2009 pandemic influenza, when Rich Besser was the director of CDC. He was continuously communicating. He was continuously talking. He was talking with truth, with transparency, but also saying what we didn't know, what we hope we would know, what the science was saying. You know, I see CDC, for example, just this past week, they put out a guide and said, hey, face masks work not only to protect you from infecting others, but actually to protect you.
Right.
Well, but it would have been nice to have a press conference in which somebody explained how they reached that conclusion. What was the evidence that got them there? How come they didn't say that before? Because right now you just say, oh, they were hiding information. They knew all this and they never told us. So you create also conspiracy theories when you're not able to communicate and when you're not able to say, look, we knew this then, but now this is what we know now. And this is how we're translating it. And this is how our guideline process developed. And this is where our recommendations develop. So having that communication in which, you can relate to the public in the media, in social media, what you made, what decisions you made, and how you change your decision making, I think is incredibly critical. And it's something that's as new as this. That, to me, is something really missing. And we're also missing the role that CDC has in communicating with the states and in guiding the states and in really, quite frankly, also, pressuring the states to do something. There's ways in which CDC can do things. For example, CDC can say, you will not get more COVID testing unless you implement a mask mandate. You will not, but because all that was decentralized and the states started doing their shopping for testing on their own, then there was no leverage to be able to do those kinds of things.
Yeah. So let's go back for a minute to the masking, because we really have had 3 different messages about masking that have come out of the CDC since March. So the first was only healthcare workers or frontline workers needed to wear masks. The next one that was pivoted to was it's probably a good idea for almost everyone to be wearing a mask. And then this week, the additional news, in the middle one, it was the mask is to protect the people around you, and most people should be wearing them. And then this week it was the mask is also going to help you. Those pivots, as you point out, did not get a lot of press and time to be explained that they were science moving forward and learning. And so that's a place that you think CDC could have been leading us in this conversation.
Communicating recommendations to people is so hard, right? And you and I have worked for years in HIV, so we know how we went from telling people to not have sex to prevent infection to abstinence, to telling people to have sex only with a condom to prevent infection. And now we're telling people it's okay to have sex as long as you are taking antiretrovirals, because now you're taking PrEP and you won't get infected. It's really hard to communicate those very changing messages every time. But as science advances, what your recommendations are actually change. And that is part of science, but communicating that is critically important. And you need to be able to do that with transparency, with truthfulness, and in a way that the community understands what is the science and what is the evidence that leads to that change in recommendation.
Absolutely. And CDC not only has incredible scientists, they have incredible communications team that help the scientists put together the appropriate public communication. And so that's really been missing as well from all of this.
Oh, totally. But as I said, what I'm missing is a press conference every day or every other day, or every time there's a new change where somebody stands up and explains this and says this in front of national television, which I'm sure every single network would cover the CDC press conference. Every single network would want to hear what CDC has to say, as opposed to having what's happening now is they make a change and they call you or me or Sanjay or somebody and say, okay, can you interpret what CDC did? We're trying to do the translation and saying, well, I think maybe this is the evidence, but we're not sure. And that is really bad.
Right. It's a bit of a game of telephone. We could have just had CDC standing up and speak. So let's talk about an opportunity that we have right now. There is a change in the administration coming our way. We have a new president-elect. He's put forward a pretty robust COVID-19 plan and a team to talk about it. What opportunities do you see for CDC coming back to being the main player?
Well, the first opportunity I see is actually, again, I go back to saying CDC is a national treasure, but it's actually a gem here in Atlanta. The first thing I would love to see, we have 4 candidates for the Senate, the 2 Georgia seats that are competing for a runoff that's happening on January 5th. I would love to see the 4 of them put out a statement, each one in their own campaign, saying, look, we all disagree in a lot of things, but one thing we all agree on is the value of CDC, and we're going to be supportive of CDC. Regardless of who gets elected, I would like our senators to be the staunch supporters of CDC because CDC is important to Georgia. So That's the first thing I would like. I would really like to see the Georgia candidates for Senate to issue a strong support for CDC, because that political support is really important.
Right.
The second thing I would like to see is literally the day after he takes office, CDC, the president needs to come to CDC. He needs to meet with the employees there. He needs to have a town hall. He needs to say, you guys are valuable. You are incredibly valuable. We're going to be listening to you, and we're going to be implementing your recommendations. I think to bring up the morale of people at CDC, that needs to happen. And then, of course, the president will have to appoint a CDC director, but I think appointing a director and waiting for that to happen to start doing things is too late. That's 10 weeks away. The current administration, the current leaders at CDC need to step up and just take charge. They have to start going out to the press. They have to start communicating. They have to do whatever they can to assume the leadership role that they deserve and they need. And, too bad. If the White House doesn't want it, they'll get fired, but they'll get fired for 10 weeks and then they'll come back. But the reality is we are burning right now in the country. Quite frankly, we cannot afford to be sitting down and waiting for, in 10 weeks, we're going to save it, because in 10 weeks, the house will be burned to the ground.
Yes, the numbers are mounting way, way too quickly. And to remind everyone who's listening, it's only taken us 8 days to get to the most recent 1 million cases. We're going to approach 11 million cases probably within the next 2 to 3 days at the rate numbers are increasing.
Yes, I want to emphasize that. It took us over 100 days to get to the first million cases. It's taken us 8 days to go from 9 to 10 million, and it's probably going to take us 4 days to go to 11 million.
That's exactly right. We hit 10 million on the 8th, and we were, as of last night, we were at 10.7 million on the 12th. So yes, it is staggering numbers that we've got going on in the United States. So beyond the new administration, you propose that CDC folks start speaking out under the cover of the president-elect, or how should they be doing that right now?
They need to be doing it because a lot of CDC employees are members of the public health service, right? They are part of the military. They're members of the United States Public Health Service. They need to do it under the cover of defending the nation from a threat. And I think that is the way that they need to do it. They need to do what's best for the nation at this point in time. And they need to have a very frank conversation with the leadership of not only of CDC, but with the leadership of HHS, and says, hey, we need to start doing our job. We need to start communicating. We need to start acting, because this is not going well.
Well, yes, it's definitely not been going well. And I think, to be clear, we're not questioning that they're doing their job. We're questioning their ability to speak to the public, which is something that they've been kept from doing.
But part of their doing their job is that communication. Part of them doing their job is that way. I mean, that way of communicating those nuisances that you and I talked about, right? Explaining. I mean, if you're going to say the number one priority right now that I see that we need to have as a nation is we need everybody to wear a mask. I don't care if you're a Republican, a Democrat, or independent. This is not a partisan issue. This is a public health issue. And we need that public health message strong and clear. Director Redfield, when he testified in front of Congress a few weeks ago, he said, if every American wore a mask for 8 to 12 weeks, we would be in a better position. And the president then said, well, he's confused. He doesn't know what he's talking about, whatever, and threw him under the bus. Well, no, he needs to come back and say the same thing over and over and over. And he needs to say, yes, wear a mask, wear a mask. So we need that message loud and clear. We need the message of social distancing. We need the limiting the number of people who gather indoors loud and clear. And then we need testing. Testing in our country we've done a lot of testing, but the testing hasn't been done as a public health testing. If you have been involved in testing, we have been doing testing, but not in a way to do the kind of testing that you identify people and then you rapidly isolate them and then you rapidly, do contact tracing and then prevent further transmissions. That hasn't happened. We haven't done the kind of public health testing that needs to be done during a pandemic. And the technical expertise to do that relies on CDC.
That's exactly right. There are other parts of the world who had much better success with testing and tracing from their plans. And they've also been countries where we've seen more public health officials leading the conversation on the national stage.
Now, I would say, though, that right now, there's so much COVID out there that nobody can do contact tracing. We first need to tame down the flames. We need to bring down the number of infections down. And if that requires, everybody staying indoors and wearing a mask and making that a national mandate, let's do it, because we are burning right now. We cannot, I'm afraid of what's going to happen over the next 2 weeks.
Yeah, exactly. And we've got holidays coming up and, we know folks want to be together. This is a really tough year to find a safe way to try to do that.
But Jodie, that actually also brings a lot of the message we've heard from public health is don't do this, don't do that, don't do that. People don't want to hear no, they want to hear how. You don't want to hear, you and I have been involved, for example, with the Atlanta Opera. And I've been very, very pleased that we've been able to have music in a reimagined way. We were able to say, okay, let's do it outdoors. Let's have people in pods. Let's separate the audience. Let's have singers in masks. Those that are not having masks, let's put them inside literally plexiglass cages. No, we're not going to have a chorus here. We're going to, live stream the chorus. We've done all sorts of things to make the audience safe and to make the singer safe. We've done testing, and so far things have gone well. But that's what we need. We need ways to say, this is not about public health versus the economy. This is how can we keep the economy going by doing the necessary public health adjustments so we can continue having an economy. I don't want to have lockdowns. I want to avoid lockdowns, but we need to do it in such a way that it's safe to continue operating in some very modified way.
Right. Creativity is certainly the game right now. And when we think about a lot of different things that we want to do to keep the economy going and fun going and jobs going and things like this. All right. So as we think about our friends who are at the CDC, what are some of the messages we want to say to them as we ask them, to come back and help us communicate all the incredibly important messages we need?
I first thing is to say we love you, right? We appreciate what you're doing. We care for you. You are valuable to us. I think the morale is incredibly down. People there are working very hard and have been beaten so hard that I think we need to really tell them we appreciate you are a treasure for Atlanta. The second thing we need to do is they need to figure out how do they identify the right people and how do they work with us more closely in order to help amplify their message. We need to hear, I would love to get, 20, 30 people of us in the country, get an email from them every day saying, these are the key messages we need to be given today. This is, CDC has pioneered this communication, SOCO, single, focus communication. Well, what are the 5 messages we have to give out today? All of us who are in the media, this is what CDC wants us to say and say and say and say it over and over. And also CDC is going to say it, but we're just going to amplify it. And we're going to stay on message and we'll continue repeating that message. Then we need to figure out how do we expand their workforce, right? What do we need to do? How come Georgia doesn't have the necessary number of contact tracers? What do we need to do to help them? How do we mobilize resources to the most affected community so we can have the testing in place, so we can have the contact tracing? And how do we deal with those difficult circumstances of super spreading events? How do we ensure that we don't have any super spreading events and that we're able to actually control them very rapidly so they don't happen?
Yeah. And actually write about each one of them, because then we learn every single time MMWR carries a super spreader event, we learn something else about what we need to be doing with COVID-19.
So all those, I just read this MMWR that I'm sure you read today about these weddings that led to super spreading events, right? So Do we tell people not to get married, or what are the recommendations for weddings to still happen that we can actually give to them?
Right. We can't stop all weddings for the year 2020 and 2021 coming forward as well.
Yeah, but there may be ways that we can say, this is how you decrease the risk. How do we implement testing? How do we do this? How do we do that? You know, again, this is all about communicating risk reduction. Risk reduction is such a critical tool of communication, and risk mitigation has to be part of this conversation.
Absolutely. And positive messaging, as you pointed out, is really the messaging that we need. You know, here are what we are asking you to do to help your community, to help keep numbers down and to protect everyone. And lockdowns do feel very punitive, and there are a lot of positive messaging that we can put out there, and different steps that we can take instead. All right. So, any last thoughts about how we can support CDC? You know, you and I both have a tremendous number of friends who work there. We need to call on everyone running for the Georgia Senate to make statements about the CDC. We need to support our friends and make sure that they know that we appreciate their work they're doing, and we miss their voices.
Well, you know, again, get on the phone, call your representative, tell them that they need to support CDC. Call, you know, send emails to whoever you need to, but just let's help CDC remove their shackles so they can do what they're best at. Because right now we need them. We need them more than ever.
Yes, we do. People are dying by about 2,000 a day, with coming up on 200,000 cases each day being diagnosed in the United States. There's not a time we possibly need our public health task force and the rest of the folks at CDC more.
You know, again, you know, quoting some of our heroes in public health, Bill Foege says, nobody's going to thank you for a disease they didn't get. But that's what public health does. CDC, their job is to prevent you from getting a disease. So if CDC is doing their job, people are not going to get COVID. And people, I think, are going to be thankful. I am thankful if I'm not gotten COVID because I follow the recommendations. So I think we need to change the paradigm. I hope people start thanking others for diseases they didn't get.
Wouldn't that be awesome? And yes, Dr. Foege certainly has had some wonderful quotes and wonderful leadership in public health at the CDC and in Atlanta and across the world. Dr. Del Rio, I want to thank you. You have been a real light as we looked to folks to fill a void for communication about COVID-19. You're on the TV most of the time when I turn it on, and you have had positive and consistent and truthful messaging. So I want to thank you for that. And I want to thank you for shining a light on our CDC colleagues and how much we need that right now. We really have missed their voice, and I look forward to them joining the voice and all the prevention messages that we need in the United States right now. Thank you everyone for watching. Dr. Del Rio, thank you so much.
Thank you, Jodie. Really appreciate it. I enjoyed talking to you, and thank you for all that you've done. I mean, you've done an incredible job leading the response from Rollins and doing the testing and going to the Hispanic communities. And again, this is what we all need to do. We can stop this, but we need to work together.
Thank you, dear. I appreciate working with you every day. And again, thank you everyone for watching. Please wear your masks, stay socially distanced, wash your hands, and stay safe.
Have a good